This is Melody Medley Key. I'm a doctor of physical therapy here at Lakeway Aquatic Physical Therapy in beautiful Lakeway, Texas. Today our seminar is on hip and knee pain. And what you see in the background is someone walking. And you're probably going, Melody, what does this have to do with my hip and knee pain? Well, what we've discovered clinically is that by analyzing the gait, and I'm like specifically analyzing, and you all know on our phones we can do slow-mo very easily now, and we can analyze what little deviations you are having when you walk. And these little deviations can cause pain into your hip and knee. As I kind of tell people all the time, guess what? The hip bone's connected to the knee bone's connected to the ankle bone. Yes, I know. Singing is not my big treat here, but it's a plus you get today. All right? So, but by analyzing the gait biomechanics and understanding the biomechanics of how the body moves, we can then understand why you're having hip and knee pain. So again, if more of your pain is in the side or the back or the front of the hip, then we can do that with a gait analysis. If your knee pain is more into the middle or the side or right in the middle, right here, then our gait analysis will explain that to us. So we don't just take a look at, oh, the hip hurts, let's just do a hip stuff and I'll just do hip stuff. No, we take a look at the whole body. We analyze everything that's going on with you. And we try to get an idea of what you're doing that is causing the hip and knee. So there goes to our whole analysis here at Lakeway Aquatic Physical Therapy. We're trying to get to the cause of the cause, not just put a Band-Aid on it, right? So once we analyze your gait and we can get in and figure out what is happening with that gait analysis, and we start doing a slow-mo on it, and you all have done that, so we do a slow-mo, so then we can show you kind of the things that we're working on. So that's the first step. Then you say, well, I'm still getting pain. So what we'll do is we'll set up a specific program for you. As I say, everybody's different. The way you walk is different. The way you move is different than someone else. So a program specifically for you to help with getting the joints moving correctly, because once the joints move correctly, then the tendons, the ligaments, the muscles, and everything will follow in suit. The joint is the big guy. So when we come in, then we see, wait a minute, we analyze, you do have some biomechanical issues, but wait, your hip or your knee are really swollen and they're really not doing right. So what we can work on here is we have what we call the Hyvamat, okay? And the Hyvamat stands for Histological Variable Manual Techniques. And I can use all kinds of utilizing the intermittent electrostatic field to create deep oscillations. And if you see on our Hyvamat, it has all kinds of programs where I can work all different types of things, right? So if I say, okay, it's more of a ligamental sprain, then I can work the Hyvamat. And this goes as deep as an ultrasound, but yet it uses electric current, a cross current, and oscillations through it. And that helps with blood flow, inflammation, and just everyday associated healing that is happening. So those of you that are out there, well, I've been icing. The ice kind of helps, but it doesn't help it all the way. So this is where the Hyvamat can take it to the next level and really start helping with the inflammatory process and helping with what is happening in your knee, in your hip, in the hip joint, all of those variables down below, even in the quad and the thigh, because a lot of times with hip you do get this pain here, or this pain here, or this pain all the way up and down. So that's what makes it nice with the Hyvamat, that I can do it on a very large area, where ultrasound, I really can only do an ultrasound just in a specific bony prominence area. But the Hyvamat, I can do all the way up and down, all the way in. We can do it in. If it's more in the knee, coming from the ankle, we can do the whole lower leg, front and the back, back into the popliteal fossa, where a lot of people get a lot of pain in their knees and swelling and stuff. It makes it difficult to bend the knee and things like that. So that's where we start. Again, gain analysis, getting to the cause of the cause. And then we're going to help it by helping with the healing process, the inflammation. And then once we get the joint moving, everything's feeling better, that's when we start the strength training mode of it. So if you have any questions, please feel free to call. You can always reach us on our website at www.lakewayaquatics.com or on our Facebook page at lakewayaquatics.com. Facebook page. And if you have any other things, just please feel free to call us. Our phone number's here. We're ready to answer your questions and help you in any way you want. All right? Have a great day, and we'll see you when you're out walking correctly. Have a good day. Bye-bye.